So now I have the distinct honor of welcoming our keynote speaker, Dr. Beth Frates. Dr. Frates is a trained physiatrist and a health and wellness coach. Excuse me. She's received several teaching accolades from the Harvard Extension School and the Harvard Medical School, where she is an assistant clinical professor. Dr. Frates is one of the first fellows of the FACLM and a pioneer in lifestyle medicine. In 2008, Dr. Frates created the first lifestyle medicine interest group at Harvard Medical School, and we have one here at Downstate now, which is fantastic. In 2014, she developed and taught a college lifestyle medicine curriculum at the Harvard Extension School, and it is still one of the most well-received courses offered at the school. Dr. Frates is the current president of the American College of Lifestyle Medicine. Dr. Frates literally wrote the book on lifestyle medicine. She authored a lifestyle medicine syllabus, which can be downloaded through the FACLM website to serve as a template for other instructors and professors. She also co-authored the Lifestyle Medicine Handbook, an introduction to the power of healthy habits. To accompany the syllabus and the handbook, she co-created Lifestyle Medicine 101, which is an entire course that is available with full slide sets and lesson plans to the public. So that is just a fantastic addition. In addition, Dr. Frates co-authored the Teen Lifestyle Medicine Handbook, which was published in 2020. And when it's paired with the teen curriculum, which consists of a teacher's manual and 12 PowerPoint decks, it can be used to teach and empower middle school and high school students to adopt and sustain healthy habits. In September of 2023, Dr. Frates co-authored the Lifestyle Medicine Pocket Guide. As director of the wellness programming at the Stroke Institute for Research and Recovery at Spaulding Rehab Hospital, which is a Harvard Medical School affiliate, Dr. Frates has created and implemented a 12-step wellness program, which is called Paving the Path to Wellness, for patients and providers. Most recently, she co-authored the book, Paving the Path to Wellness Workbook, a guide to thriving with a healthy body, peaceful mind, and joyful heart. And as of the fall of 2020, Dr. Frates serves as the director of the College of Lifestyle Medicine and Wellness for the Department of Surgery at Mass General Hospital. In addition, Dr. Frates has her own lifestyle medicine consulting and coaching practice where she sees patients one-on-one and in groups. So I think it's pretty clear that we have an expert on our hands here, and I would like to invite Dr. Frates up.
Thank you so much. Thank you so much for that warm introduction, and I am a New Yorker. So I'm in Boston, yes, but I'm a New Yorker, and it really feels good to be back home. So thank you so much. I want to mention that when I arrived, I was in the crosswalk, and Nadine, many of you met Nadine, she gave you your name tag. Nadine came straight up to me and said, "Welcome, Dr. Frates," and escorted me across the crosswalk and into the room, and I said, "This is New York hospitality. This is the way New Yorkers do it." That was probably planned, who knows? But anyway, I'm so delighted to be here today. It is a true honor to speak with you and spend the day with you. So I know I have an hour, correct? Terrific. To share some of my passion in lifestyle medicine to build on what you've already heard today. Do have some disclosures. I've been on the Scientific Advisory Board of Jenny Craig Medical Advisory Board of Obvious Solutions and Clearing.com, and I have my own lifestyle medicine consulting practice. Today, with you, I want to focus on discussing these 6 pillars of lifestyle medicine that you've heard about already, how they relate to surgeons, physicians, and patients alike. So what do we all have in common in this room? Anybody? Name some things we all have in common. We care about health, I heard. We care about food, yes?
The ability to make choices.
We believe in the ability to make choices, autonomy. We are passionate about lifestyle change. Yeah, and I'm thinking even simpler than all of your minds. We're all human beings and patients. Please tell me, nobody, just look down. If you have a primary care physician of your own, please just raise your hand. Nobody look around the room, just raise your hand. If you have thank you. This is a real passion for me, especially recently, because I have a dear colleague who's a physician who did not get his PSA followed up on and now has prostate cancer. So it's a real personal issue I have with physicians who are not following up with their own care. Healthcare providers who do not follow up on their own care. So I'm pleased to see the majority of you do have a physician. Okay, so we're gonna highlight the role of each of these pillars for health. That's physical health and mental health, both. How many are mental health specialists in the room? Yeah, terrific, great. It's so important for you to give us feedback and for you to bring this back to your communities. And then identify ways in which the pillars influence each other. It's really important. There are these 6 pillars, but they're not separate. They're not in silos. You saw this definition. Dr. Rosenfeld showed this to you. I'm going to go into a little more detail and share some things here. Lifestyle medicine is a medical specialty. How many of you knew that before coming to this conference? Okay, so a lot of you did, some of you did not. You can in fact be board certified in this specialty as of 2017. And in this specialty, we use therapeutic lifestyle interventions as primary modality to treat, to manage, to put into remission when we can, as you heard, and to prevent chronic conditions, including our #1 killer, which has been our #1 killer for decades, heart disease, cardiovascular disease, and of course, a risk factor, a major risk factor for heart disease is diabetes. We talk about and call out type 2 diabetes in our definition, and obesity. So when you're certified in lifestyle medicine, and how many of you are through the ABLM or ACLM, many of you, terrific, that means that you know the doses. You know that these pillars are like pills. So physicians who are lifestyle medicine board certified prescribe pills. Sure, you heard Dr. McMacken talking about metformin. Yes, you prescribe pills when indicated, but you also prescribe pillars. And there are doses, intensities, and frequencies to these pillars, like there are for pills. And you learn that when you're board certified. I do have to say one of the biggest honors in my career so far was being asked to be one of the 4 item writers for the initial examination in 2017. And that tells you I'm a massive nerd. I love getting into the science, and that's what we're gonna do a little bit together today, and I hope that you enjoy it as well. So when you're certified, you're trained to apply evidence-based whole person. You've heard about whole health? Anybody in the VA system? Whole health. Okay, no. So using the whole health model at the VA, they talk about mental health, social health, physical health, and the whole person, treating the whole person, not just their signs and symptoms of disease. We do that, a whole person prescriptive lifestyle change to treat and when used intensively often reverse or put into remission these chronic conditions. You heard the 6 pillars, you're gonna hear them again today multiple times. Whole food, plant predominant eating pattern, that's what we use at the American College of Lifestyle Medicine. Physical activity, restorative sleep, stress management, avoidance of risky substance, and a focus in on enjoying positive social connections. Can you raise your hand if you enjoy positive social connections on a daily basis? Love this group. Okay. And we are doing that together today, and that's why I'm delighted to be with you all day, so that I too can connect with you. Now, we have talked about patients. Dr. McMacken beautifully described 2 patients that influence her to this very day. I also have a patient that influences me. Do you have a patient that influences you day in, day out, and inspires you? I'm just curious. You may or may not. Does anyone, if you do, just raise your hand? I'm just curious. So some do. So I'd love to share the story of this patient. He has given me full rights to share everything about his story in hopes that it will inspire others. Would you like to hear the story? Yes. Oh, terrific, good, okay, good, because I want to tell the story pretty badly. Okay. So I love being here in New York. I'm not often present in New York, so again, honored and delighted to be here. I am sharing with you a story of a New Yorker This gentleman here, does anyone recognize him, by the way? If you recognize him, don't say. But if you recognize him, maybe just raise your hand. Okay? So he has a familiar look, and he has a very familiar story. The medical students have asked me if that was Herb Benson. It is not. Herb Benson is the founder of the relaxation response at Harvard, so the Harvard medical students have that in their head. Other people ask me if it's Gerald Ford. That is me next to him, so that's awkward. And those are the medical students asking me, so anyway. And then I get a lot of other people that he looks like, and his story is very, very common. Maybe you all relate to it more than most. So, New York City businessman. He's 72 here, but I'm taking you to a time when he was 52. Doesn't look like any of you have reached that age yet, but think about being 52. New York City, overweight, overworked, businessman, overstressed, who dined almost exclusively on fast foods. Ate fast, walk fast, talk fast. We're in New York. And at the corners of New York, you can find what? What do you find to eat? And the hot dogs, pretzels, this is what he would be consuming while he was walking and talking with clients, with colleagues, getting it done. Because he took over his father's business, and he was dedicated to his clients. How many feel in this room dedicated to their patients? And this was a dedication that was beyond this norm. This was extreme dedication, such that he would go into the office at 6, return home around 11:30 at night, and spend a lot of the night not sleeping. So when we think of the pillars, you already heard nutrition was atrocious. Sleep was non-existent, an hour or two, and then he'd be up, go to the kitchen, go to the cabinetry, and get what? Yeah, he's not getting kale and quinoa. Nope, no. For those of you who shouted that out, that's not what he was getting. He was getting Oreo cookie double stuff. He was getting Cheez-Its. He was getting those orangey cheese noodles. What are those? Cheetos. Yep. He's getting Cheetos, potato chips, ice cream, and then he'd go back. Then he'd wake up. He'd make lists of what he had to do for the next day. He'd be up at 5, ready for the 6 a.m. train into the office. So sleep, non-existent, stress high, nutrition, challenged. Social connection, married with kids at the time, teenagers, loving wife and family. Connected to his clients, connected to work. When he was home, which was rare, obviously, he wasn't present. Do you know what I mean? He was home, but his head was at work. And everybody knew that was around him. And then I'm missing a major pillar. Which one? Yes, thank you. So for exercise with this gentleman at 52, it was non-existent. Now, he was an outstanding baseball player, soccer player, basketball player, very active growing up. But at 52, he was sedentary. But he did do one thing. No one has ever guessed it, but I'm in New York, and I'm thinking in this audience, someone's going to get this right. I just feel it, although no one has ever gotten it right before. What did you say?
He ran, sketched the tree.
Do you know the story? This is New York. I said to myself, this is the only group that's going to get it right. I can't even believe it. And I was going to offer a book, any book you wanted, to someone who got it right. And I'll still offer that. So you heard about several books. You can pick whatever book you want, and I'll get it to Rich, and he'll get it to you. But anyway. Okay, so the story goes, but it's kind of ruined now. I was good. No, it's fantastic that you asked. Are you kidding? No, I'm so excited that you gave the right answer. So what I was going to tell you was he didn't do any exercise routinely, which is true, he didn't. But I was going to tell you he did one thing. He did it at the exact same time of the day, but you never knew what day he would do it on. But you knew the time of day he would do it. And you knew that activity was going to be sprints, mad dashes from 101 Park Avenue, and you all understand this better than any audience I've ever talked to, so from 101 Park Avenue to Grand Central Station, which was what you immediately said. What's your name? Mihir. I can pick on Mihir all day now because he got the right answer, which is what Mihir said. Now, on one of these sprints, this is at 11:07 p.m. He timed it out because he knew how fast he could get out of the office and to the train station. That's this man. So he, at 11:07 on one of those days, sprinted, and what happened? Little pain, little pressure, no pain, no gain. Sure, he's strong. He made it to the train. His wife, teacher, no experience, none in medicine, looks at him. He's diaphoretic, short of breath, pale, and she takes him right to the local emergency room where he completes his massive myocardial infarction and subsequent middle cerebral artery infarct on the right side, leaving him paralyzed on the left side. The day in the life of a New York City, overworked, overweight, overstressed businessman. So, good news, he went to PT, OT, worked for a full year. Anyone in physiatry here? Physical medicine rehab? We do have a PT right here, Dr. Katz, just heard about it, yes, wonderful information you shared. Is that it, the two? Oh, three, terrific, okay. So thanks to people like you, he made a full recovery except for, as you know, fine motor movement in the left hand. But he went to Prediabetes. This is in 1986. New York City, smart guy, does his research, says this happened to me, it's not gonna happen to me again. So he goes to Prediabetes. Anyone know Prediabetes centers? Pioneers in lifestyle medicine, pioneers. So they were doing this in the 80s, helping people like this gentleman reverse their disease, reverse their lifestyle, and get into healthy patterns with eating, with exercise, with stress resiliency. So he got an exercise bike, was on that bike, reaching the guidelines, so that means he was accumulating how many minutes of physical activity? So half hour, 5 days a week, accumulating 150 moderate intensity exercise minutes in the week. And he changed his diet to be half the plate fruits and vegetables, a quarter whole grain, quarter healthy protein, no red meat, as it was in 1987. And he became more loving, more connected with his family. He worked from 8 in the morning till 2 in the afternoon, started sleeping better, and lived his best 27 years of his life after that stroke at 52. So that's my dad, and that happened to me, happened to him, at my age of 18 when he was 52. I was the next generation to take that business over, financial advising and accounting. I was already an economics major at Harvard at the time that this happened. I was a freshman. But that changed everything for him, for me, and here I stand before you, having watched that and then researched it basically since I was 18 and been on the journey for myself, of course. First, I wanted to prevent that from happening to dear old dad because I love the man. Now, he wasn't present and he had struggles, but I love that man. Even though he was living that very challenging life, of course, I loved him. So I didn't want it to happen again. I wrote a book about how to prevent a second stroke after going to Stanford Medical School, coming back, going to MGH, doing my internship, doing my physical medicine rehab training, and like Dr. McMacken said so well, I learned nothing about what I knew was the crux of medicine. So I wrote that book, and then a colleague of mine, Dr. Eddie Phillips at Harvard, said, "You're doing lifestyle medicine." This was 2006. I said, "I'm doing what?" Lifestyle medicine. I said, "I don't know, but it sounds like what I'd want to do." So from that moment on, I have been sold on this field and working my tail off to help progress. So, 6 pillars of lifestyle medicine. Can we do a little exercise together? Are you up for it? Okay, then I invite you, and this is an invitation, no one has to do this, right? This is an invitation. I invite you to stand. I invite you to remove all shame, blame, and guilt from the room in your own head and we are not judging anyone in this room, okay? There's no judging in this room. Now, we are going to remain standing if we can answer yes to questions. If we can't answer yes, we are going to sit down. The people that remain standing, I'd be happy to get you books like I will be doing. But I do want to mention this. Some people just feel like sitting, so you can't judge anyone. Someone may just feel like sitting, to be honest. Somebody just may want to sit down, and you're free to sit when you like, okay? So we don't know what's really going on, but we know that you're only going to stand if you can answer yes to these questions. Is this fair? But no judging. Okay, thank you. Ready. Are you accumulating 150 minutes of moderate intensity physical activity each week? There's no judging, so no one's judging anyone. It's fine. And by the way, if you're lying, there's a buzzer, and it buzzes. So I noticed that happened, and people sat down. Okay. Oh, sorry, can't leave that one yet. Are you strength training twice a week on non-consecutive days? The buzzer, it happened. Some people are just tired because they're not strength training, so they're sitting now. That's fine. Nutrition. Are you consuming 5 servings of fruit and vegetable each day? Now, I'm not saying 5 of fruit and 5 of vegetable, but that would be great. I'm saying a combined. Every day, combined, 5 servings. You'll get that today. Okay? Right. Sleep. This is where all the surgeons and physicians go bye-bye. We'll just say it out. But anyway, 7 to 9 hours routinely. Bye-bye. Okay, again, there's no judging. I feel people are judging, and judging themselves and judging others. No judging. Stress management. Do you have a go-to stress management technique that you utilize in a time of crisis? This is when, if you're working with people, they'll get you to sit down. In a time of crisis, and you practice 15 minutes a day of whatever stress resiliency technique, like yoga that you just saw. That counts. Walking in nature, deep breathing, you pick. Okay, wow, well, look at our crowd go. Woohoo, oh, got a little buzz. Okay, or tired, someone's tired. Okay, social connections. Are you connecting with someone and feel support from someone every day? At least 7 times in the week, we'll say, the literature shows us. So 7 times in the week, you're, okay? Do you have someone we call a charismatic adult, someone from whom you gather strength? You have someone in your life. If you're in a tough spot, you can call someone, okay? Are you a charismatic adult for someone else in this world? Okay? Now we get people to drop like flies here too, but okay, let's try. Let's try. It's not about tobacco, but yes, we'll start with that. If you do not smoke, it's a yes, and you remain standing. Okay, here we go. I'm the messenger. American Heart Association guidelines. That's what I'm sharing with you right now. If you don't drink, don't start. And now, if you are a woman and you drink 0 to 1 drinks a day, you remain standing. If you're a man and you drink 0 to 2 drinks a day, you remain standing. Now, I've been in Greece. I'm part Greek. My grandparents came from Basara, around Sparta, and immigrated to East Boston. So I visit Greece. I give talks in Europe, and they always ask this question. So you may be asking it too. Does it count 1 at lunch and 1 at dinner? This is a 24-hour period. Folks, this is a 24-hour period. Okay, wow. So I have several books, Rich, if you can look around. 1, 2, 3, 4, 5, 6, and then there's 7. 7 books to give out. Okay, so fun. Now, you may sit or stand. You can remain standing. And anyone can stand up at any time during this presentation, by the way. Feel free to stand up and walk around. I do not mind. Why? Exercise is so important. Now, we have about 40 minutes from what I can tell left, and we are going to talk about each pillar. Those recommendations and why those recommendations are in place. The medical model. Now, I think, Dr. McMacken, you learned a little bit about exercise and cardiovascular disease. Right, me too. In medical school, we learn a little bit about this, how exercise impacts cardiovascular disease. Helps prevent cardiac disease and stroke. We know this for many years. Reduces blood pressure, controls blood glucose. So essential for the reason that we're gathered together today. Actually can increase insulin sensitivity when we exercise. Control weight, helps prevent obesity, helps prevent bone loss. We're on the osteoporosis, not just diabetes here. We're talking about everything and around chronic conditions. All right, can increase self-esteem, energy, improve mood, and decrease stress. For those of you that do exercise, because the majority of the room remains standing when I ask the question about aerobic activity, why do you exercise? Anybody? Anybody? Why? Yes? You feel good afterwards? Yeah. You swim. It's beautiful.
I was just planning my laps.
I love it. Getting ready for that feeling of relaxation after. Anybody else? Any other reasons? Yes? So you don't yell at your kids. I love your honesty. Thank you. See, that's beautiful. Okay, we've learned no shame, blame, guilt in this room. So we can be authentic and honest, and that's where it all starts with lifestyle medicine. Yes, so you're less stressed. I get that. I have a 24-year-old and a 22-year-old boy, both, 2 boys. So I understand exactly what you're saying. Anybody else? Reasons why you exercise? Feel better about yourself. Yes, yes, yes. You want functionality. You want to be independent. You want to maintain your muscles. Yes, and you?
I want to help my bones.
You want to help your bones. Look, osteoporosis. Thank you so much, Dr. Katz. Yes. Increase your energy levels. Do you want to be productive? You want to be happy? Yes. Rachel.
I've got an accountability partner that brings me to exercise.
Wow. Built-in accountability. Love that. Somebody was over here.
That's my mood.
Mood, love it, love it. Do you know how and why? I'm just curious, I don't know. You may not have been taught this by anybody. Most people don't know.
I feel less achy.
Oh, beautiful. Isn't that nice? Yes. Terrific. Again, someone was out over here. Longevity. Want to live a long life. Add life to years and years to life. Beautiful. Okay. So I have a reason for exercising, and I did think one of you New Yorkers was going to match mine. So wait, why do you exercise? Yeah, I'm sorry. Okay, ready? Why do you exercise? I'm just wondering if you're the answer.
Why do I?
Yeah.
I think a lot of the reasons people said, like longevity, stress
Yeah.
management.
Okay. So no match. That's fine. Yeah. So I exercise for brain. Sorry. What example? Example to my patients. That's a great, great point. I think you may know some of my research, but I'm not sure. So I exercise for my endothelial cells. I know. No one else says that. I'm literally the only person that exercises for their endothelial cells. I want my endothelial cells to function well. I am worried about what? Oh, yes, I'm worried about a heart attack and a stroke because I know I've got a family history of that. You can't get rid of that. I live with that since 18. I know that. And I don't want what I saw my dad in the hospital, not able to move one entire side of his body at 52. Okay, so this is the medical model, and it's been around for years. Many of us learned about cardiac disease. Now, I love to emphasize the mental health model. Interesting, no one said this, but improved sleep, one of our major pillars. Oh, did somebody say it and I missed it? Oh, okay. You thought it. Okay, that counts. No. Thanks for being open because that counts. Stand up again. That absolutely counts. So we had it in the room in New York. I love it. Yes. So improve sleep. It's so important. We're going to get to the sleep pillar, but I'm going to ask you, does anyone know about amygdala flares? Ooh, this is a fun, okay. So it has something to do with sleep, and it'll come up in a little bit. Better endurance, stress relief. This is the mental health model. Improvement in mood, ba-boom, ba-boom. Such a big one. Increased energy and stamina. Reduced tiredness that can increase mental alertness. Weight reduction. And then lastly, they put on their list, reduced cholesterol, improved cardiovascular fitness. So it's just interesting to see the difference in the way the benefits are emphasized in the mental health model and the mental health model. I feel close to you guys, so we'll share this. I didn't put it on here because, well, I had it for a CME at Harvard, and I I was admonished for including it. So I'll say it here because we're a closed environment. And the medical students usually mention this. Another benefit of exercise that was in the article, and that's why I put it in my Harvard CME material. It was from a medical literature article. It was just a fact. Anybody know what I was admonished for? Thank you. You said it. Wait, you said it. I didn't say it. You said it. Yeah, that's right. I didn't say it because it's being recorded. If anyone's I didn't say it. Okay. So here, this is from a medical textbook, and you'll see my favorite one, endothelial cell function increases. When I show this to patients, you heard I'm also a health coach, they look at that with a blank stare. They do not care one thing about that chart. No, not one thing. Now they start looking. Your brain loves the gym. That's really fascinating. So I hope I'm going to teach you something. Anyone know BDNF in the room? Raise your hand, and I will ask you what it is. Are you ready?
Yeah.
Okay.
Brain-derived neurotrophic factor.
Brilliant.
Skeletal muscles release it during exercise, and that results in increased hippocampal volume, associated with increased cognitive performance.
Yeah. Absolutely. Yes, absolutely. Whoops, okay, that's a big step. Yes, yep. So we're going to go through this for everyone else. You're going to see a picture of exactly, sorry, what was your name? Vis. Exactly what Vis said. Okay. But here you go. People don't know this. Doctors don't know this. Healthcare providers don't know this. When you exercise, you release dopamine. Improves motivation, focus, and learning. Blood flow, you know this. Enhances, increases, so you get oxygen to your brain, removal of waste. That one people know. Serotonin is released. This is why we have an improved mood. We have studies, the SMILE study, comparing serotonin reuptake inhibitors, so that's increasing serotonin, an antidepressant, versus placebo, versus exercise, 150 minutes each week. And the serotonin levels go up the same in the medicine and the exercise. And the depressive symptoms go down the same. I'm not telling you to get rid of your antidepressants or your patients to get rid of them. No, I'm not. That's very good medicine. But I'm saying maybe like Dr. McMacken, they're on it, and then you add some exercise in, and you get them exercising. Maybe they don't have to take the antidepressant for the rest of their lives. I'm not against medicine, be clear, but I'm just trying to share that there are some other things that we may be able to do to help our patients and help ourselves. Endorphins are released. Anyone get an endorphin rush? Just raise your hand if you do. I'm just curious, because a lot of people don't. Exactly. Majority of our audience does not. I do. I'm a runner. I love it. I've been doing it since I was a teenager, for my brain, for my health, for my mental health. And I get a runner's high. So I didn't need drugs. I'm like, I don't need drugs. I just gotta go for a run. And what's funny is somebody said, you want to be an example. I thought it was to my kids, but it's also for patients. But so for example, I have two boys. What does one do when he's stressed? What does one do? One of them. Yes, he runs. He also says it's for his mental health. Where'd he get that? I don't know. So norepinephrine is released, improves attention, perception, and motivation. Here's our BDNF, miracle grow for the brain, miracle grow for the brain. BDNF, brain-derived neurotrophic factor. Increases neurogenesis. When I was at Stanford, I learned that there were a certain number of neurons. You had to protect them. So yeah, we're rollerblading at Stanford. You rollerbladed to class, true, but you always had a helmet. So we were always protecting our neurons, and I'm still protecting my neurons, sure, but I realized that all this exercise is really helping me increase the number of neurons in my brain. Protect and repair neurons from injury, degeneration. We know this in PT, in physiatry. What is a stroke patient? You're getting them up and out and trying to get them moving again, using their muscles. Hormones combined with BDNF. Do you know which hormone, just to put you on the spot? I'm hoping I'm going to teach you something. Do you know which hormone binds with BDNF? I'm going to send it to you. Mental telepathy here. Go, go, go. Okay, we'll come to it. Not yet. So hormones combine with BDNF to increase the number of neurons and synapses. Also, as you heard from Vis, you can change the structure of your brain. This is very powerful information. Helping your endothelial cells, people don't really care so much. Changing the structure of the brain, they care a lot. You can increase the size of your hippocampus by MRI. They're looking at the volume of the hippocampus. What does the hippocampus do? Memory, helps with memory. We have diabetes, we have obesity, we have dementia. Everybody's worried about those. This speaks to people, speaks volumes to people. So you know this. United States Health and Human Services, 150 to 300 minutes of moderate intensity physical activity in the week. What does moderate mean? You can talk and not sing. I think a lot of you are doing vigorous right now. That means you can't even talk when you're doing it. If you're doing that, then the requirement is 75 to 150 minutes of vigorous physical activity in the week. Then don't forget that strength training. So here we go to Visa's point, right here. Your muscles are metabolically active. You just heard it from Vis. They do release a myokine called irisin. That's what Vis was thinking. And here, irisin, we're in a diabetes conference. Please look at the pancreas. Increased beta cell regeneration and function, increased beta cell survival. This is critical for patients with diabetes. Now, you know, and you probably knew before coming in here, when you exercise, increased glucose uptake. We're going to help with our glucose levels, and we recommend that patients who have prediabetes or diabetes are taking walks, exercise, snacks, before eating, after eating, through the day. It's helpful. You can see that irisin also works on adipose tissue, and I want to point out that it works on the brain. It says here appetite regulation. All of these are interconnected, these pillars. So many of you may know when you exercise regularly, it's not one bout of exercise, but when you're exercising regularly, say for 4 weeks, you often decrease cravings. This could be irisin, or it could be lactate. Who knows N-lactoylphenylalanine? This is a new metabolite found at Stanford in, I believe it was June 2022. And this has been associated with decreased feeding. And that is released when we exercise. N-lactoylphenylalanine, lactate. That could be another reason why people who exercise are experiencing less cravings and are reducing the amount of food that they intake. It's complex, but these could be. This is why I love lifestyle medicine, because I love getting to the science. Why? What's happening? How is it happening in that way? So you're sitting. It's hard because you know sitting is the new smoking, and I'm looking at you all smoking. So if you want to stand, go ahead. It's up to you. But if you want to remain sitting, you may get into sedentary physiology. You may not be aware of this, but lipoprotein lipase decreases, triglycerides increase, HDL decreases, and glucose control is disrupted. The American Diabetes Association recommends those with prediabetes and diabetes stand up every half hour. All the rest of us, or people that do not have prediabetes or diabetes, are to stand every hour. Interconnection you already saw through irisin and lactate. This is research that you know and you've probably done on yourself and with others and with patients. Exercise reduces urges for sugary snacks and attenuates urges in response to stress situation and the cue in overweight people. So I have nothing against Wegovy, and I think Wegovy is a powerful medicine, can really help many, many people. You're going to be on it for your whole life. That's tough. Can we get you to a place where you're doing a lot of exercise, maybe releasing the irisin, maybe helping with appetite suppression, or lactate helping with appetite suppression, and then you're experiencing less cravings, maybe. So we talked a lot about diet already. This is Dr. David Katz. He's a former president of the American College of Lifestyle Medicine, a good friend now, and I admire his work very much. He's a very logical thinker. He's very organized. So a decade ago, and I heard him, I was just with him on Friday, and I've heard him speak on this. This is an annual review in public health. He usually did this every 5 years, or was planning to do it at least every 10, but he says this still stands, and I agree. Look at the different diets, dietary approaches. Low carb, low fat, vegetarian, vegan, low glycemic, Mediterranean, mixed balanced, you could put a dash in there, and then Paleolithic. These are all variety of dietary patterns we hear. And you heard from Dr. Rosenfeld, keto, Atkins. By the way, keto can be vegan. So different names for different eating patterns. But what is in common? That's his point. He started a True Health initiative to find what's in common. Well, let's look. the compatible healthy elements of all these different diets. Limit refined starches. You heard that from Dr. Rosenfeld already. Limit added sugars. Limit processed foods. Limit the intake of certain fats, and you know that's trans fats, saturated fats. Emphasis on whole plant foods with or without. This is where you all asked. Lean meats, fish, poultry, seafood. Get into the debate about that. But limiting it, eliminating it as part of the whole food plant predominant dietary pattern is what we're doing at the American College of Lifestyle Medicine, and research, as you already heard, is ongoing. Who knows who said this summary statement? Eat food, not too much, mostly plants. Yes, Michael Pollan. Michael Pollan. And it's very good advice. Let's talk about vegan. When you're vegan, you know that you're not eating animal product. But what are you eating? Could be chips, right? It could be multiple other processed foods that aren't from animal product. It doesn't define what you're eating. It defines what you're not eating. We don't want to be eating processed foods, ultra-processed foods. The data is out on this, and I'm going to say everyone agrees on this. And that's because the data is so powerful. So for each additional serving of ultra-processed food, all-cause mortality increased by 18%. You can see ultra-processed food consumption servings per day. On your x-axis, y-axis is all-cause mortality. So now you're asking yourself, what's a serving? First of all, we need to teach our patients whatever it is, you've got to look at your ingredients and your package label. I did have a patient who said, this is unbelievable, look at this cookie. And I'm thinking, oh no. And it's a huge cookie, about the size of my head. It's a massive cookie. And he's so excited to say, I found these cookies, there's only 15 calories. I'm like, what? I mean, there is no way. So he said, oh, wow, wowie, wow, ooh, I wonder what could be in that cookie. Could you do me a big favor? Could you get the package? No, it's in the garbage. Oh, it's in the garbage. Could you go into your garbage for me, please? Because we're meeting by Zoom. Could you go into your garbage? Do you mind? I mean, is there anything really gross? No? Okay, so dip your hand in there, get that package for me, gets it out. Guess how many servings were in a cookie? 15! I mean, who does that to someone? That's criminal. Anyway, so chips, 1 ounce or 18 chips is a serving. Now let's get into this data. Because you heard Dr. Rosenfeld, what's important is what are you eating? Yeah, that's what I say all the time. What are you eating? A meta-analysis of cohort studies, this is not small study. This is 500,000 people. Participants found that a higher intake of fruit and vegetables associated with a reduced risk of death from cardiovascular disease. Average reduction in risk of 4% for each additional serving per day of fruit and vegetable. This literature has been around for a while, but we don't talk about it. Why? Let's talk about it. Nurses study, compared with those in the lowest category of fruit and vegetable intake, that's less than 1.5 servings a day. Those who averaged 8 or more servings, guess how many I'm trying to have every day? Guess. This is a cool, they showed, I've been waiting for a chance to do this. I've never seen a pointer like this. They showed, this is like brand new stuff. Yeah, that, 8, yes. 8 or more servings a day. We're 30% less likely to have had a heart attack or stroke. So you know I'm going for 8. Individuals who ate more than 5 servings of fruit and vegetables per day had roughly a 20% lower risk of coronary heart disease and stroke compared with individuals who ate less than 3 servings. So some is better than none, just like exercise. Get people to eat some. Get people to do some walking. Get them up higher. More is better. Get them up to 8. Now, why? See, I'm always the why, and I know many of you are the why too, because you're New Yorkers. We like to get to the root of this. This is it. This is the way we are. So why? Yes, I get it. Vitamins, minerals, and antioxidants. That's good enough for me. But that's not always good enough for everyone else. So what else is in fruits, vegetables, and whole grains? And those carbs that people are saying are awful. Whole grains are carbs. Fruits and vegetables do have carbs. They're not awful. What do they have? They have fiber. Do you know that we're a fiber-deficient nation, and who's talking about it? Nobody. Nobody's talking about we're a fiber-deficient nation. Not one person. 5% of us are getting the amount of fiber that is required, which by WHO is 25 to 29 grams of fiber. How many of you, again, just look down, how many of you are getting about that a day? Yeah, so we're fiber deficient, not all of us in the room, but most people are fiber deficient. How does it come into diabetes? Well, we know by research that when you're consuming that amount of fiber, 25 to 29 grams a day, you can lower the incidence of type 2 diabetes, heart disease, stroke, colon cancer. Why though? Why? Because when we eat fiber, the microbiome ferments it. Why do we care? Anybody? What? Why do we care? I'm going to always go to you.
Because they release chemicals which are important for brain health. As well as
Beautiful. Yeah, beautiful. We'll take it. So they ferment the fiber and create short-chain fatty acids, like acetate, propionate, and butyrate. You may have heard of those before. Why do we care about those? We care about those because those have an influence on our metabolism, on host metabolism, immune system, and cell proliferation. That's not good enough for you New Yorkers, so here you go. Here's your dietary fiber, here's your gut microbiome, there are your short-chain let me use my there's your short-chain fatty acids, acetate, propionate, and butyrate, go through the L cell of the gut, increase GLP-1. I've been talking about this since 2019. No one cared. Now everyone sees this. Increase PYY, increase proglucagon, increase L cell proliferation. I have to tell you that this natural GLP-1 lasts for minutes, right? Wegovy, it's a week. So it's not comparable. But if you're eating fiber, you can get a boost in your GLP-1, short-lived. But if you do this 3 times a day, it's short-lived 3 times a day. Why do you care? That also impacts energy metabolism, glucose metabolism, lipid metabolism, lowers inflammation, helps with immunity, and decreases our risk for cancer. Here's a healthy plate. This is from Walter Willett, Harvard Healthy Plate. Walter Willett, Eat Lancet. He is the guru that I follow and have followed for years, probably 2 decades. He was the chair, he just stepped down, of nutrition at the Harvard T.H. Chan School of Public Health. So he has been studying the science of nutrition for his entire career. Just had him speak at the American College of Lifestyle Medicine Annual Conference in Denver in 2023. Important announcement. If you haven't been paying attention, please pay attention now. The annual conference for 2024, celebrating our 20th anniversary, is still open. There's 1,000 seats, Rich. We're still open. I just checked with our executive director. We will sell out, though. He's correct. Every year we sell out. And this anniversary year, we're going to sell out. So please do come. Okay. Walter Willett spoke in 2023 at our annual conference. We get amazing speakers. And he talked about, yes, this healthy eating plate. You heard about the government's plate. Now this plate has water, then half fruits and vegetables, quarter whole grain, quarter healthy protein. And they note, choose fish, poultry, beans, nuts, limit red meat and cheese, avoid bacon, cold cuts, and other processed meats because they're carcinogenic, and there is evidence, as Dr. Rosenfeld shared, that red meat itself is carcinogenic, processed or unprocessed. So when you look at the healthy plate, healthy people, healthy planet on the left, which is Eat Lancet from Dr. Walter Willett and international experts, you'll see a very similar plate. It has an allocation. It has an allocation for animal-sourced protein, which is like a hamburger a week. And some dairy food. But in general, it is plant foods, plants, eating plants, nuts, seeds, legumes. How do you get your protein? Nuts, seeds, legumes, beans, vegetables even peas have a great amount of protein. It's shocking for many people. Now we're doing diabetes, so let's go to the American Diabetes Association plate. Whoa, it looks very similar. Vegetables are there on half the plate. And then you have carbohydrate foods where they're including starchy veggies, potatoes, corn, winter squash, and fruit. Yes, wonder if you can eat fruit. The American Diabetes Association says, yes, you can have fruit if you are someone who has prediabetes, diabetes, or you're worried about diabetes. Now that's a revelation for many people, including physicians. That is from the American Diabetes Association. Plenty from their protein sources there. Plenty of protein-rich, plant-based options, beans, hummus, lentils, and others. We're all moving in that direction. American College of Lifestyle Medicine is helping lead the way with many, many resources that are for free. You can even get them if you're not a member. If you're a member, I think you have access to more resources and more courses. But this is in Spanish and multiple languages. You can get How to Eat on a Budget, this dietary spectrum, helping lead people go from the standard American diet, you know that's the SAD diet, to the whole food plant predominant diet. We're talking about diabetes, but diabetes is connected to so many other conditions like depression. So food for mood, what should you eat if you're interested in your mood? You can exercise and you can have fruit and vegetables because those are associated with decreased incidence of depression. Now, how are these eating patterns disrupted? Stress. Stress increases the desire for hyperpalatable foods, foods that have salt and sugar and fat layered upon each other like a French fry from a fast food. Dad ate tons of those. And it is likely the high cortisol levels that are partially responsible for our gravitation to these hyperpalatables when we are overstressed. What is stress? You're New Yorkers, you know exactly what stress is. Engineering term pressure or tension exerted on a material object. We're talking about this psychological stress, a state of mental or emotional strain or tension resulting from adverse or very demanding circumstances. We are in these circumstances and have been for many, many years. Some could argue pre-COVID, healthcare was in a state of extreme stress. So some stress helps us get to the deadline. I had to get here on time. There was a day I had to show up. I had to plan. There's stress in driving here on time. Okay, but that helps me to perform, to get up here and get myself here. If you said, come give a talk at some point, if Dr. Rosenfeld said, hey, can you give a talk at SUNY Downstate sometime? I'd be like, yeah, sure. Without a deadline, it's never going to happen. You need deadlines for chapters, research, articles, etc. So some stress helps us to get peak performance, but that's not what we're talking about. We're talking about stress that is so intense and so chronic that it starts to deteriorate our system. Where? The hippocampus. Don't worry, because you've probably felt stress and now you're worried about your hippocampus, because what can you do to counteract that? In chorus. Thank you. Perfect. How is it that stress impacts us so deeply? We know this. It's through our brain. We get signals through the hypothalamus, then the HPA axis. You know about this. Your adrenal gland releasing the cortisol, the epinephrine. Then you get pro-inflammatory activation, and behind many of these chronic conditions is simmering inflammation. Stress is just adding to that. And we know that stress creates behavioral changes, eating what we shouldn't, perhaps going to substances, and not exercising. There's also the cardiometabolic changes that happen with increased hypertension with stress. How about stress, depression, diabetes? It's all interrelated. Look at the research, look at the literature. Chronic psychological stress, increase in the HPA axis, that increases the cortisol, which increases intra-abdominal fat, as you know, increasing waist circumference. We talk a lot about BMI, but we're really talking about distribution of fat and where we have lean muscle and where we don't. And then the autonomic nervous system activation with the increased epinephrine, norepinephrine leads to, our topic today, insulin resistance, increased hemoglobin A1C, increased triglycerides, lowering our good cholesterol HDL. And then stress itself leads to inflammation, increased IL-6, increased C-reactive protein, and then my favorite, endothelial dysfunction. That's stress. I want to remain stress-free, as you all want to. So I'm going to give you 14 evidence-based ways to do so. Get out into nature, forest bathing. You can look it up here. Exercise, we discussed. Mindfulness. We did a little bit of that with yoga. There's mindfulness-based stress reduction, John Kabat-Zinn's program. I did that in 2014. Wow, a decade ago now. It was life-changing. You can do an 8-week course, CME course. I did a 5-day intensive in mindfulness-based stress reduction for physicians and for patients, because we're one and the same. Meditation changes your brain. You can increase your prefrontal cortex. Playing with your pet releases oxytocin when you pet that furry animal. Okay, someone's going to say, what about a turtle? What about a lizard? Thank you. Everyone always asks that. I'll just ask it myself. The literature isn't there, so I'm not sure. I think it's the furriness that allows for the oxytocin release, but I'm not sure. So if you do have a pet or that's a turtle or a lizard, you can see for yourself, do your own experiment. Does it release oxytocin and reduce your own stress? Take your vacation. Who takes vacation? The Europeans all raise their hand, and it's 2 weeks in August. And you know that for a fact. We don't take our vacation. Some of you are, majority are not. Who takes deep breaths throughout the day like we were just led in? I do. Turn on that parasympathetic, I love it. Diaphragmatic breathing turns on parasympathetic. Music. Medical students use this #1 way to reduce stress. What kind of music? People always ask. Depends who you're talking to. If it's my brother, it's Led Zeppelin. Awful. But he loves Led Zeppelin. I like classical. Whatever works for you to reduce your stress. Practicing yoga, you just did it. Laughing, I love it, as you know. And that reduces stress. Expressive writing reduces stress. Something simple like chewing gum, you're not to do that in this theater. Checking email less frequently, that's much harder. If you can get a handle on your email, that'll really improve your stress level. Sleep, okay, we don't have that much time left, but I'm going to go through the rest of the pillars with you. These are more straightforward. Sleep, you need 7 to 9 hours of sleep. National Sleep Foundation. They've done the research, not me, and I'll show you the research as to why that 7 to 9 hours is in place. Nap, people ask, especially in Europe, yes. Napping, the siesta, 20 minutes before 3 p.m. It won't disrupt your nighttime sleep. Here's the data. This is why it's 7 to 9 hours. So duration in hours on your x-axis, hazard ratio incidence CVDs on your y-axis. Look at the nadir, right there, 8 hours, 7 to 9 hours, that's our goal. Because we want to reduce our #1 killer, which is heart disease. Sleep deprivation, maybe you're surprised to see diabetes listed here, maybe you're not. But sleep deprivation impacts these conditions: high blood pressure, heart disease, obesity, and diabetes. And we know this. And we know data about this that I'm sharing. You may not know, 5 nights of sleep restricted to 4 hours per night results in 24% decrease in insulin sensitivity, 30% decrease in acute insulin response to intravenous glucose. This is important for diabetes, prediabetes and diabetes. Lots of endocrinologists do not ask about sleep. It's very important. Go back and talk about sleep with anyone who's working on their blood glucose control. Yes, ask about exercise and irisin and all this, but don't forget sleep. Now, I'd like to talk about mood. Many of you mentioned exercise helps with the mood. Well, guess what? What amount of sleep is recommended for mood? This happens to be the same, 7 to 9. Now, something that impacts most of you, although I know many New Yorkers do not drive because you take other forms of transportation, but it's very important to realize when we have residents and they're going home and they are driving. I was one. Actually, as a medical student, after my surgery rotation, I fell asleep at the wheel. Has anyone fallen asleep at the wheel? Is the most scary thing, I think, that has happened to me personally, and it changed the way I interacted with sleep, and that was back in 1996. But there's data now looking at reaction time of those that are sleep deprived and those that have had alcohol. So reaction time reduces with sleep deprivation, reaction time reduces with consumption of alcohol. This is from an Australian study. Being awake 18 hours, your reaction time is similar to someone who has a blood alcohol of 0.05. Being awake 24 hours, which we ask our residents to do, their reaction time is similar to someone that has a blood alcohol of 0.10, and you know 0.08 is legally drunk. Food for thought, we need to think about it. I tell the residents to take an Uber home after call. Well, that's because I fell asleep at the wheel. So when they are home, and when you are home and you're in control of your sleep and you are not on call, make your bedroom like a cave, quiet, use earplugs, use white noise, use pink noise, rain, use whatever you need. I know it's New York and it might be very loud where you are, so get earplugs or some white noise. Cool, did you know this? You want your bedroom to be 67 degrees, that's the sweet spot, but between 60 and 70 degrees Fahrenheit. You need it dark, blackout curtains, I use them. Maybe you want an eye mask, it depends where you live. I know you're in New York, so light is coming at all hours of the night if you're in the city. So you've got to know that and do something about it. You know you want to avoid blue wavelength light, blocks melatonin. You know that melatonin is released by the pineal gland, and the pineal gland will be blocked if it gets blue wavelength light. So put your laptop away, your cell phone away, 2 hours to 3 hours before bed. Now you can't do that. Blue wavelength blocking glasses, blue wavelength blocking apps. Anybody know the half-life of caffeine? 6 hours, 4 to 6 hours, about 6 hours, good. Anyone know the receptor caffeine binds to? Many of you have been through medical school. Thank you so much, Fees. I love it. I'm giving him the microphone for the rest. Yes, adenosine. Do you know why we care that caffeine binds to adenosine? Okay. Throughout the day, ATP is used, adenosine builds up around 11 p.m. You'd be at your maximum if you did not have caffeine within 12 hours of that period of time. For some people, it varies. Adenosine's that signal for sleep. So if you have caffeine close to bedtime, caffeine binds to that receptor, not adenosine, and you do not get the signal for sleep. It's the opposite effect. It revs up your cells. Adrenal gland responds by producing adrenaline. So we need to ask our patients about caffeine. Now, how does sleep deprivation impact food consumption? Sleep insufficiency is associated with a significant increase in desire for weight gain promoting high-calorie food items following sleep loss, the magnitude of which is proportional to subjective severity of sleep loss. Let's give numbers, you New Yorkers, because you want them. Volunteers who slept only 4 hours ate 300 extra calories compared to those who got 9 hours. What else does sleep impact? You know. Mood, outlook, productivity, creativity, sociability, relationships. I mentioned the amygdala flare. If you're sleep deprived, you're 30% more likely to have an amygdala flare where you are emotional and irrational, and your prefrontal cortex, or your CEO of your brain, is not helping you. Your amygdala is speaking only. So sleep is essential for a healthy lifestyle. Now, social connection, important pillar. Vivek Murthy has said we are in a loneliness epidemic. Well, we have known the power of social connection since 1979. Lisa Berkman, who was in California at this time of the study, and she was working from 1969 to 1974, she put together with Leonard Syme, this analysis. Following Alameda County residents, men and women, you can see both sides. This is a bar graph. We have age on the x-axis, percentage died from all causes. In this prospective, it was a 9-year study. So, no, I do, it's good. I don't have much time. I'm a little stressed, I'm sweating, but I'm gonna get through it. They're pushing me. No. Don't worry, we got it. So here, look, women, men, all ages, 30 to 49, 50 to 59, 60 to 69. Now, how many connections did they have? Least connected, that's the diagonal lines. Every age group, both men and women, over the 9 years, they were the most likely to die if they had the least connections. Men, women, every age group. That's what you need to remember. Now, why is that? Research is there. Low quality and quantity of social ties is linked with development and progression of cardiovascular disease, recurrent heart attack, atherosclerosis, high blood pressure, cancer, delayed cancer recovery, slower wound healing. They're getting stressed. I think I'm going over. Let's see how it works. Everybody breathe deep. Okay, so, all right, I have the mic and the clicker, so I'm going over here. So, social connection is so important. The social structure, the structural social network aspect, and then the functional network aspects. Looking at social support, social exchange, social engagement, all this impacts the health pathway over here. It impacts if we're smoking and drinking, how we're managing our stress, if we're exercising, our self-efficacy coping, our cardiovascular immune function. Our social connection is powerful. Robert Waldinger knows this. I'm going to give you the bottom line. Guess what he says from his study of 80 years looking at Harvard graduates, their families, and inner city people in Boston. He says that taking care of your body is important, but tending to your relationships is a form of self-care that is so important, and that's the revelation he's come out of this 80-year study with. The power of connection. He even wrote a book on it. So how are social connections disrupted? Oops, substance use. Absolutely, and you know during the pandemic, this went up. For providers and patients alike. Why? Because they were bored, because they had increased stress. So let me cut to the chase. I already told you what the American Heart Association says about alcohol. Let's talk about alcohol and diabetes. Don't worry, Rich. This is the last slide. Ready? So normally the liver releases glucose, maintains blood sugar levels, but when you drink alcohol, the liver's busy breaking down the alcohol. So it does a poor job of releasing glucose into the bloodstream. This leads to drop in blood sugar levels. Do the diabetes patients know this? And the problem is, then it's hard to know, is it from the alcohol, is it the low blood sugar that you're experiencing this drowsiness, confusion, dizziness? It's important that we teach them about the limits and the dangers of alcohol. 1 drink is a beer, 5 ounces of wine, or 1.5 ounces of distilled spirits. Now I have to say, to conclude, I am the messenger of this message. Thank you. It's been around for at least 6, well, almost a decade now. For cancer prevention, no alcohol is a recommendation. If you read The Lancet in 2023, you can go deeper into that, but they say there's no safe dose of alcohol for cancer. I just want to share that alcohol impacts sleep. It reduces REM sleep. You may think it helps people fall asleep, and it may, but it disrupts their sleep. So it's not high quality sleep. It can disrupt your relationship, your eating pattern, so many things. And we are all patients, and group coaching is what I do for surgeons and physicians now at Mass General. You could join me there, or I could start doing it here, who knows. But this is a free bundle for you if you're interested in lifestyle medicine. You can get 5.5 free CME CE and learn more about nutrition, food as medicine for health and for disease, and an intro to lifestyle medicine. And that does complete our journey together through the 6 pillars of lifestyle medicine. Thank you so much. Thank you so much. Sorry for going over. Wow. I love New York. I do love New York. I just knew this was going to feel so good. Thank you so much for that. It really touches me deeply. It means a lot. And Rich will be less mad now that I went over.
Thank you so much, Dr. Frates.
Yes.
I'm going to ask that maybe you hold your questions. One of the things that's amazing is that Dr. Frates is going to be with us for the entire afternoon. She will be part of the networking session this afternoon. So everyone will have a chance to interact with Dr. Frates at that session.